Chapter 22, the Respiratory System, Part 1. Here's a view of the thoracic cavity where much of the respiratory system is found. There's the lungs, trachea, main bronchi. There's the pericardium that used to surround the heart. The heart's not there anymore. Kind of cool picture. All right, respiration. Respiration involves a number of processes. First up is pulmonary ventilation. Pulmonary ventilation is the exchange of air between the atmosphere and the air spaces in the lungs. So inhalation, bringing it into the lungs, exhalation, sending it out, collectively known as pulmonary ventilation. External respiration is the movement of gases between the air in the lungs and the bloodstream. So external respiration occurs in the lungs. It's the movement of oxygen from the air in the lungs to the bloodstream, the movement of carbon dioxide from the bloodstream to the air in the lungs. Internal respiration occurs all throughout the body. This is the movement of oxygen from the bloodstream to the tissues and the movement of carbon dioxide from the tissues to the bloodstream. And so this is involving capillaries all throughout the body, oxygen leaving the bloodstream, carbon dioxide entering it. There is, of course, also cellular respiration, which we talked about a long time ago in Unit 1, and that is the use of oxygen to make ATP. So that is, of course, what the mitochondria do. All right, structurally, the respiratory system is broken up into the upper respiratory system and the lower respiratory system. The upper respiratory system is the structures in the head and neck, so it includes the nose, nasal cavity, and the pharynx. The lower respiratory system is the structures in the neck down into the thoracic cavity, so larynx, trachea, bronchi, and lungs. You can also break the respiratory system up into functional zones. We have the conducting zone. The conducting zone is the structures whose main job is to move air throughout the head, neck, and chest. So this is all the various tubes that are interconnected all the way down to the microscopic terminal bronchioles. So various functions that occur in the conducting zone include the ability to smell. So the receptors for smell found in the roof of the nasal cavity. It includes filtering the inspired air, the air brought in. This is occurring because there's mucus on the lining of our respiratory system, and that mucus will catch particulates in the air. We also have production of sounds, so the larynx, of course, has the vocal cords that allows us to produce sound. And then finally, the inner structures of the respiratory system are excreting a small amount of water and heat, making the air we breathe in moister and warmer, which is very important. The respiratory zone, the second zone, the respiratory zone, is where the gas exchange occurs, where oxygen leaves the air in the lungs, carbon dioxide arrives from the bloodstream. And this occurs in the respiratory bronchioles and the alveoli, these tiny microscopic structures found all throughout the lungs. So gas exchange, as I mentioned, is one important function in the respiratory zone. The other function, which you might not have known before today, is that the respiratory zone also helps to regulate blood pH. pH, how acidic the blood is. Turns out that if you remove carbon dioxide from the bloodstream, that will raise the pH, make it less acidic. Or the other side, if you don't release the carbon dioxide, then the blood will become more acidic. So basically, how fast or slow we breathe can affect the pH of blood. All right, the nose, as we know, external structure. It's the entranceway and the exit for air. Air both enters and exits through the nose. It is made of bone and cartilage. The internal nose, inside the nose, you find the nasal cavity. This large space that is lined with a mucous membrane. This mucous membrane has many ciliated epithelial cells. It has cells that are producing mucus. That's the name mucous membrane. And cilia that will move the mucus along. Within the nose is also a wall called the nasal septum. This divides the nasal cavity into two parts, two sides, a right side and a left side. There are these three bumps coming off the lateral walls of each side of the nasal cavity. These are called the nasal conchae. So one nasal concha, three nasal conchae. Turns out there are actually six because it's three on each side. And they push into the airspace. When air comes into the nasal cavity, it has to swirl around these structures, better mixing the air within the nasal cavity. Here's just a frontal section of the nasal cavity, inferior nasal concha, middle nasal concha, and superior nasal concha. Here down the middle is the nasal septum. Also, as mentioned, we have the olfactory epithelium. Olfactory epithelium lies on the roof of the nasal cavity. This has the receptors for smell, olfactory, olfaction, the sense of smell. Also found in the nasal cavity are little openings for the paranasal sinuses found in some of the bones of the skull, and also an opening for the tear ducts, so that these are routes that carry tear fluid from the eyes and mucus from the paranasal sinuses. Functions of the nose include olfaction or smell, filtration of the incoming air, warming the air, and moistening the air. This is all from the mucous membrane. The mucus will collect particulates out of the air, and then body heat will warm the air and water will be released, moisturizing the air. And then, of course, the very important job of conducting air to or receiving air from the pharynx. The pharynx, the back of the throat. The pharynx, back of the throat, starts at the end of the nasal cavity and ends at directly above the larynx and esophagus. So this space is the pharynx. The pharynx is also lined with the mucous membrane. However, it does not have any cilia. There's no cilia in the pharynx. You can break the pharynx up into three regions. You have the nasopharynx. Nasopharynx comes directly after the nasal cavity. Within the nasal pharynx, you'll find the pharyngeal tonsil. There's the oropharynx. Oropharynx is directly posterior to the oral cavity, hence the name oropharynx, and it also houses the palatine tonsils and the lingual tonsils. And then the third part is the laryngopharynx. Laryngopharynx is directly above the esophagus and larynx. So it goes nasopharynx, oropharynx, laryngopharynx. And its function is to conduct air between the nasal cavity and the larynx. So it's a connecting structure for the nasal cavity and the larynx. Which of course brings us to the larynx. Larynx is directly below the pharynx, and it connects to the trachea, which is inferior to it. The larynx houses the vocal folds, the two vocal cords. It is houses the structures that allow us to produce sounds, speech. And also there's a structure on the larynx that helps to route food and drink to the esophagus, so that when we eat or drink something, it'll go into the esophagus, not into the larynx. We know when that structure doesn't work because then we cough mightily. Here is the view of the larynx. So the hyoid bone is the superior structure of the larynx. We also see the epiglottis here. Epiglottis is a piece of cartilage that will fold over the top of the larynx. This will all close it off, routing food to the esophagus, preventing it from going into the larynx. So again, the epiglottis will fold over when we swallow, covering the opening to the larynx to prevent food and drink from entering the larynx. The anterior cartilage that sticks out very prominently, that is the thyroid cartilage, also known as the Adam's apple. And then there's an inferior rounded cartilage called the cricoid cartilage. This is the inferior part of the larynx and attaches directly to the trachea. And so here on a person, it's about where the hyoid bone is, the thyroid cartilage, the cricoid cartilage. Within the larynx, if we do a mid-sagittal section of the larynx, we can see that it has these two little folds on its lateral walls. The superior fold is known as the vestibular folds, and the vestibular folds can open and close, controlling airflow through the larynx. The inferior fold is the vocal fold. The vocal fold is the structure that produces sound. And so we have a pair of vocal folds and a pair of vestibular folds. And while there is a mucous membrane lining the inside of the larynx, there is no cilia. Air, of course, passes through the larynx. When it passes through, it causes the vocal folds to vibrate. This vibration is what produces sound. You can increase the pitch on the being produced by increasing the tension, making it tighter, making the vocal folds tighter. This is done by muscular contractions. So more tighter the strings, the vocal folds, the higher the sound. And then you could increase volume of the sound just by increasing airflow that is going past the larynx. So the amount of air that's passing the larynx increases the volume, plucks the string harder, as it were. Trachea. Trachea is the inferior structure to the larynx. It is in front of or anterior to the esophagus. It enters the thoracic cavity, so it's both in the throat and in the thoracic cavity. Its main function is to connect the larynx to the main bronchi branching off the inferior end of the trachea. And also, since it's lined with a mucous membrane that has cilia, it helps in filtering the air, warming the air, moisturizing the air. If you look at a transverse section of the trachea, you can see that it has these incomplete rings that are made of cartilage that help to keep it open, and there is always an airspace, an open space within the trachea. So the lumen of the trachea is always present, filled with air. You can also see that the trachea's wall has 3 layers. The innermost layer is the mucosa, basically the mucous membrane, the mucosa, made of ciliated epithelial cells, some of those cells producing mucus, which is very important for catching particulates in the air. And the cilia are very important for moving the mucus up to the pharynx so we can swallow or spit it out. The next layer, out, is the submucosal layer. Submucosal layer houses some glands found in the trachea, mainly mucus-producing glands. Then the third layer is the fibromusculocartilaginous layer, and that is just telling you what it's made of. It's made of fibrous tissue, it's made of muscular tissue, so right here is the muscular tissue, and it's made of cartilage, the big piece of C-shaped cartilage discs that help to keep the trachea open. So fibromusculocartilaginous layer, just telling you about the C-shaped rings of cartilage that will keep the trachea open, and the muscular tissue also found within the trachea. And then the most superficial layer, the outermost layer, is called the adventitia. It is just some connective tissue, helps hold the trachea in place. Tracheotomy. Tracheotomy is when an incision in the trachea must be formed in order to bypass some sort of blockage in the upper trachea or in the larynx. So the tracheotomy needs to occur below the larynx, below the cricoid cartilage, and provides a way for air to go in and out. And that is all we will cover in this part of the lecture.